This is a demonstration of Jos Liver database, which is built with the intention of supporting the care of hepatitis B patients. Here you see the dashboard. When you hover, it changes color and it can tell you what you should do at each point. You can view all the patients in the database. You can add clinical information on specific patients. You can see the outcome of clinical management and possible inclusion of pharmacy data. And you can close at this point. Now here, this button is for refreshing. But let's start with adding a new patient. This displays that, and let's imagine that you're giving a number to this patient as 1990. Call this patient, remember 1990, patient 1, and then you call this surname 1. And let's imagine the gender is a female, and patient was born some time ago, maybe say 1990 as well. Let's imagine after payment the patient was given a quote and has hepatitis B, and this diagnosis was made probably sometime late November. The risk factor was a healthcare worker. Otherwise, well, drug history not significant, and alcohol he does not drink. Then you set that to the database, tells you the information, then close that. Remember 1990 again, so that is gone. Come on here and let's put 1990 to see whether the patient, very good, so you can see we captured our patient, and if at the time of review that would be the day or at the time of review you've actually had a bit of changes here. The patient has a new diagnosis of hypertension. You can actually update this information here, and has started moderating something, and has continued not to drink. Then you update the information here, and then he has had ultrasound of the liver, which for normal liver, blood counts normal, liver function mild elevation in ALT. Let's imagine onboard test unremarkable, just HB surface antigen was reactive, HIV negative, viral load. Let's suggest that for the purpose of this 21,000 units. Okay, this was done just yesterday, has never had treatment, and then Dr. A was the one seeing this patient today. When you save it, it says this has been saved in the database. Okay, and then you can close this part and then go on to clinical information. Remember our patient again, 1990. Good, so you can see the patient appear here, and today, okay, yesterday was probably, let's imagine that happened, no symptoms, summary normal, viral load 21,000, liver imaging normal, and at the moment, because of the viral load, let's say chronic active disease, high viral load, high viremia. management plan, evaluate for treatment, follow plan, see in 6 months. Suitable for phone, probably yes. And this is up to A. Okay, so the first time you save that again, so it's saved now. All right, you can close that. Remember, patient's 1990. So we come over here just to see for that. The patient was 1990. You can see patient A is on an A, and it goes right through, capturing all the information we've got on that patient in this database. Here, I will show you later on how to export the information to an Excel should you want to do some data science and manipulations. And again, you can update those clinical information. But let's come to this point here. It was 1990, wasn't it? 1990. And you see the summary here. And here you have requested further liver function test and new prescriptions, none yet, and Dr. A. Okay, when you save that, good, that's fine. So you want to see that information here, say 1990, perfect, and you can see that all that you've entered has appeared here. Guys, this is a summary of how this database works. You can always refresh this to show every of the items in this part. And I was going to show you how to save this in Excel. First of all, you open the Excel, and while it is fresh when it's open, you can actually minimize this, go on to that, and then you say do that, and it actually gets that data for you, and it's opening right through in the Excel. All data that is there is available in the Excel sheet. Right, and you can see our patient that we put in now in that database. So I think this is a very useful tool